Before we begin, I want to recognize a few of the leaders that helped make today possible. First of all, Commissioner Bill Lowry, who's Vice Chair of the Cook County Health Board of Directors and Chair of the Health and Hospitals Committee for our board. Commissioner Anaya, who's Vice Chair of Health and Hospitals. Commissioner McCaskill, who has joined us as well. Thank you, Commissioner. Angela McLemore. Thank you, Angela. Where are you? Here I am. There in the corner. Okay, come on up with us. Angela McLemore from Senator Mattie Hunter's office. Thank you very much. I want to recognize Joe Harrington, who is a member of the board of the Health and Hospital System. Thank you for joining us, Joe, and for being a regular presence at these Cook County Health events. Thank you so much. And then, of course, Dr. Eric Makaitis, the CEO of Cook County Health, and Elizabeth Granado from our Bureau of Asset Management. I also want to thank the patients and the families who joined us today. You remind us of who this work is for. You represent thousands of residents and the next generation who will walk through these doors in the years ahead. Bronzeville is one of Chicago's most storied neighborhoods. For decades, it's been the center of Black culture, business, and civic life. Cook County's Provident Hospital played a vital role in that history. At a time when health care was often segregated, Provident provided Black residents with access to care and dignity. That history reflects a truth we know well. Access to high-quality health care shapes the strength and resilience of our communities. That's why today's ribbon cutting matters. Just a few miles from Provident, we're opening a new chapter in that legacy. The Bronzeville Health Center, we're cutting on the ribbon today, will provide primary care, behavioral health services, and physical therapy all under one roof. It brings services closer to home for residents, which we know promotes the holistic health of our patients and allows us to intervene early if a health risk is identified. This work reflects our values. We've seen the consequences of neglecting public health. The impacts are far-reaching. It affects not just individuals, but entire neighborhoods. This center is part of Cook County's ongoing commitment to investing in communities that have too often been neglected. We believe every resident, regardless of income, background, or zip code, deserves access to the care they need. Thanks to everyone who helped bring this health center to life. I look forward to seeing the good work it will do for our community. Thank you. Now I'm going to introduce Commissioner Bill Lowry, again, Chair of the Health and Hospitals Committee of our board and a member of the Health and Hospital Systems Board of Directors. And I would ask that each speaker introduce the person who follows. And I neglected to acknowledge a couple people who are here with us as well. Dr. Arnold Turner, who's the Chief Hospital Executive for Provident Hospital. Thank you, Dr. Turner. Craig Williams, Chief Administrative Officer. There you are, of County Care, is that right? Cook County Health. Cook County Health, okay. All right, thank you. Chief Administrative Officer for Cook County Health. And then we have a couple of patients who will be introduced at the end, Kimberly Arnold and Giselle Hernandez Jimenez. Okay? All right, thank you. Bill.
Thank you. So I am Bill Lowry, Cook County Commissioner of the 3rd District. I also serve as Chair of the Cook County Health and Hospitals Committee and Vice Chair of the Cook County Board of Directors. My daily work as Cook County Commissioner has been guided by the pillars of economic equity, education, including apprenticeship opportunities, criminal justice reform, including the triaging of the violence which is permeating throughout communities of Chicago and Cook County, and I've focused on the provision of both traditional and behavioral health care. This 4th pillar, health care, is more than a pillar to me. It's my why. It's my why because of my own healthcare journey, and it's my why because healthcare, both traditional and behavioral, is a right for all of us, not a privilege for the few. And it is my why this evening as I'm hosting the 3rd District's Behavioral Health is Wealth Town Hall meeting, and it is why this afternoon I'm joining all of you to celebrate Bronzeville Health Center. So why is mental and behavioral health care so important? Well, it's important because so many of us are suffering from post-traumatic stress disorder and we don't even know it. It's important because many of us know that we need mental and behavioral health care, but we have no idea where to go to get it. Especially after the city of Chicago closed 6 mental health care facilities in 2012. especially after 80,000 Illinoisans lost access to health care during the 2018 budget impasse in Springfield during the Rauner administration. It is essential that all of us in government work closely with all in the community as we find ways to resource mental and behavioral health care, not just in our jails, but also in our communities, as treatment breeds violence prevention, safety, and healthy living. President Preckwinkle, I, and my colleagues on the Cook County Board of Commissioners and Cook County Health all embrace this truth, and today we are modeling that truth in action. That is why a year ago, Cook County Health held the inaugural Cook County Behavioral Summit, where governmental, community, and private entities met with a singular goal: to identify strategies and partnerships as we develop a county-wide behavioral health strategic plan. That is why in April, Cook County resourced mental and behavioral health care to the tune of $44 million by launching the county's first impact fund, which provided resources to organizations throughout Cook County, resources which will support preventative behavioral health care, treatment, and support services. And that is why just 4 weeks ago, a behavioral health stabilization unit was opened at Providence Hospital. And that is why today we opened the Bronzeville Health Center right here in the 3rd District. It is here that the provision of behavioral health, physical therapy, and family medicine will be offered to our community for generations to come. It has been written that mental health is not just the absence of mental illness, it's not just the absence of pain, it's actually emotional, physical, and social well-being. So that is why mental health and behavioral health care is so important, and that is why today we celebrate the opening of the Bronzeville Health Center. It is now my pleasure to bring up my colleague and Vice Chair of the Health and Hospitals Committee for the Cook County Board of Commissioners, Commissioner Alma Anaya.
Good afternoon, everyone.
Good afternoon.
My name is Alma Anaya. I'm Cook County Commissioner of the 7th District, so I represent southwest side of the city of Chicago, and I'm extremely proud to be here today because the celebration just adds on to the many other celebrations that we're having and we continue to have under Cook County Health, and also the partnerships that we've created through this process of really becoming accessible, of really intentionally listening to what communities want, what communities need, and really putting our money where our mouth is. And I'm extremely proud because as we continue through this journey in ensuring that we do everything in our power, I'm reminded of how many times Cook County and Cook County Health has stepped up. Not only this year, not only these past few weeks, I was just talking to Dr. Turner and others of how many ribbon cuttings and celebratory occasions we've had, but this has been a journey that continues to grow and that we continue to see even before and through the pandemic. Think of how many folks we vaccinated. Think of how much money, millions, have been invested in mental health, behavioral health, and in our institution for healthcare access. Think about the love, the care, the intentionality that has been put in a place like this location. Not only the triage rooms, the individuals that are here that have so much passion for doing the work, but choosing this building, the beautiful colors, the artwork, it really shows the fact that we are really stepping up and we're continuing to really see the individuals, the patients that we have, and we're becoming more accessible, and we're really intentionally doing that to better the communities, because we know that this doesn't happen alone. Like I mentioned earlier, it doesn't necessarily happen behind closed doors. There's a lot of work, there's a lot of conversations and funding that really needs to happen. But the reality is that what we're doing today is going to change lives. It's going to continue to change life, and it will save lives in the long run. So I'm extremely thankful to all of the team that has ensured that this location is opened, to Madam President, to Dr. Mikaitis, and the many, many individuals that are entrusting Cook County to be a leader in this work. So I think I'm going to make a few remarks in Spanish. Hola, buenas tardes. Me llamo Alma Anaya, soy comisionada del 7º Distrito del Condado de Cook. Hoy estamos celebrando que estamos abriendo un nuevo lugar donde muchas personas, muchas familias van a acudir. El condado y el sistema del condado de salud ha sido un lugar donde muchas personas vienen y muchas veces nos dicen que nuestros lugares a lo mejor no eran los más bonitos, pero hoy estamos recalcando que la importancia de tener lugares accesibles es algo que es nuestra prioridad, es algo que queremos continuar y estamos invirtiendo en lugares como los que estamos hoy día para abrir clínicas y lugares donde muchas personas van a acudir a nosotros. Y esto no lo hemos hecho y no son celebraciones que lo hemos tenido nomás esta semana o las semanas o meses, ¿verdad? Esto ha sido inversión de años, inversión de pasión, de amor a lo que hacemos como sistema de salud y hoy día es lo que estamos celebrando. Solo agradezco mucho a todas las personas que hicieron este evento posible, no nomás hoy, pero para abrir esta clínica y tener esta inversión, esta pasión para este trabajo que se está haciendo. So, muchísimas gracias. And now I'd like to introduce a fellow commissioner, Commissioner Keisha McCaskill from the 5th District.
Good afternoon. I am going to be extremely brief. It is my pleasure and my honor to stand here beside our illustrious president, Tony Preckwinkle, and also Mr. Bill Lowry. The work that's being put into the county to just ensure that communities have the safety, health, and well-being that is needed to make our communities thrive. I honor that, and I want everyone to honor that alongside with me. The work is not easy, but it's being done, and we have a president that continues to push through all of the challenges to make sure our neighborhoods are equipped with the things that they need. I am one who am a champion of bringing resources to the neighborhood, and it doesn't get any closer than this if you look across the street. We're in walking distance, so we want to make sure that we take advantage of all of the programs that are being provided by Cook County Health. A great deal goes into making sure that we have free opportunities for not only health care but mental health resources, as was stated earlier. So please join us in this fight to make sure everyone in our community has equal access to every opportunity there is for safety, health, and a better quality of life. Thank you, and I would like to bring to you Dr. Makaitis, Dr. Eric Makaitis, CEO of CCH.
Okay, good afternoon. Good afternoon. Thank you, Madam President, Commissioners. I echo your enthusiasm for today's events. This ribbon cutting and opening also wouldn't be possible without the support of President Preckwinkle. The Cook County Commissioners, including Commissioners Lowry, Anaya, and McCaskill, thank you for being here today. And our Cook County Health Board of Directors, including Director Joe Harrington, who's also joined us. Thank you for being here. In these uncertain times, you've remained unwavering in your commitment to the health system and our patients. I also want to recognize some of our team members who made today possible. Dr. Arnold Turner, Craig Williams, Dr. Whitney Lynn, Dr. Joyce Miller, Wendy Luxembourg, Susie Harrington, and Erica Williams. These are just a few of the, thank you, yeah. They're just a few of the countless staff members who supported the establishment of this new health center. My gratitude goes out to the entire team whose contributions made today possible. I also want to thank our partners at Bureau of Asset Management, led by Liz Granado, who's here with us as well. They've been leading this project from lease to build out. It's because of the work you all do every day that we're able to make these investments in the future of our health system and, more importantly, in the health of our communities. We believe that healthcare is a human right, so this health center is open to everyone, regardless of ability to pay. Bronzeville Health Center represents a $10 million investment by Cook County and Cook County Health. Since 2020, we've also invested more than $13 million to grow clinical services and modernize the Provident Hospital campus, including opening the hospital's new clinical triage and stabilization center last month. By opening new clinical facilities and enhancing our existing structures, we can provide better access to care, improve outcomes, and reduce the burden of long-standing inequities in health that have impacted the South Side for too long. These investments not only enhance the well-being of residents, but also create economic opportunities, promote health equity, and contribute to the collective community's advancement. It's with pride, gratitude, and optimism that we cut this ribbon today. Regardless of zip code or insurance status, everyone should be able to access the care and services they need in a facility like this. Thank you. And it is my pleasure to invite to the podium Dr. Arnold Turner, Chief Hospital Executive for Provident Hospital.
Good afternoon.
Good afternoon.
As other speakers have mentioned, this is a special day as we add Bronzeville Health Center to Cook County's health portfolio of community health centers. And it's an exciting day as Bronzeville Health Center serves as an expansion of Providence Hospital's long and important legacy of serving residents on the South Side. Founded in 1891 by Dr. Daniel Hale Williams as the nation's first African-American owned and operated hospital, Providence Hospital cared for Black residents at a time when health care was not always accessible to everyone in Chicago. This new health center is an extension of the Providence Hospital campus and carries forth the incredible legacy and mission of the original Providence: high quality and accessible health care for all. To get to the root of health disparities that exist in Chicago, we need to ensure that everyone has access to basic medical services like preventive care, behavioral health, and rehab services. And being able to offer those services in a facility like this with a staff like ours helps welcome and embrace people so that going to the doctor's office doesn't feel like a chore or intimidating. Even more, the movement of these outpatient services from Providence to the new Bronzeville Health Center will give us more room to expand hospital-based services at Providence, helping us further meet the demands of Southside residents. We want people to feel welcome here, and I think the design and our staff will accomplish this mission. I would like to particularly thank the patients and their families who came here today. You are why we do what we do, and we do so honored to walk beside you in your healthcare journey. Thank you. And now I want to introduce Craig Williams, Chief Administrative Officer for Cook County Health.
Good afternoon. Good afternoon. This is an exciting day for the CCH team as we continue our work to ensure that patients have access to the best possible care in facilities that best serve them. Bronzeville Health Center provides essential physical and mental health services, ensuring that patients in this community and beyond can prioritize their health and live in a full, thriving life. This new health center will be home to family medicine, behavioral health, and rehab services. Many of these services were previously located at Providence Hospital's Sankstack Health Center. Primary care services will help residents detect diseases like early diabetes and cancer. Behavioral health services will help patients with anxiety and depression. And these are critical services that make the lives of everyone better. Here at Bronzeville Health Center, our teams have worked hard to ensure patients have access to a beautiful facility that promotes peace and healing. I was lucky enough to be one of the first people to see this building at Cook County Health. Me and our Chief Strategy Officer, Andrea Gibson, came and looked at this facility, and we really saw a blank canvas. And really being here today and seeing from the paint colors to the artwork to expansive windows, letting in tons of natural light and some warmth today especially. This is a beautiful space that will serve patients for years to come. This is a significant day for Cook County Health, and I'd like to again express my gratitude for the small team behind the scenes that made this happen. Folks like Josh Ablish, Berto Santiago, Superintendent Sadia Carter, Adam Weber, Giselle Castillo, Franklin Gomez, and Mark Wozni. I'm so proud of the work they have done and grateful that we continue to serve Cook County residents. With that, I will hand it off to Elizabeth Granado.
Thank you. Good afternoon.
Good afternoon.
My name is Elizabeth Granado, and I'm the Bureau Chief for the Cook County Bureau of Asset Management. I'm honored to be here today to celebrate the opening of our facility that our team is incredibly proud of. This project has been a remarkable collaboration between the Bureau of Asset Management, Cook County Health, and the many dedicated partners who work together to turn a shared vision into a reality. Today, we're not just opening a building, we're opening the doors to greater access, equity, and quality healthcare in the Bronzeville community. Our team has been especially excited about this site from the beginning. This site met the healthcare needs we were looking for, but we also saw an opportunity to preserve an architecturally significant building. This striking steel and glass structure is a wonderful example of modernist architecture, a style that's both historically meaningful and uniquely Chicago. This facility offers natural light and space to accommodate both private therapy rooms as well as large conference rooms for group meetings. We're proud to have preserved this building and returned it to productive use in a way that honors the past and looks towards the future. I would like to thank the team at the Department of Real Estate Management for their expertise in finding a site that meets the needs of the space and for negotiating this lease. Thank you to Elizabeth Strand and Patricia Moreno, as well as the entire team at the Department of Capital Planning and Policy for their work on creating this space, including Shalon Shears, Tim Ozog, Maureen Blossfeld, and Earl Manning. We've worked hard to ensure this space reflects the needs of the community it serves, creating a modern, inclusive, and welcoming environment for patients and staff alike. From design to construction, every detail was considered with the goal of supporting the highest quality care in a space that feels safe and accessible for all. We are thrilled to see this clinic open its doors and serve as a vital resource for Bronzeville for years to come. And I would like to turn it over to Kimberly Arnold, a Bronzeville patient.
Good afternoon. My name is Kimberly Arnold. I'm a patient from Providence. I'm excited to come to the new clinic at Bronzeville. I thank you guys for all your hard work and thinking about the community. Thank you.
Giselle Hernandez Jimenez, who's also a patient. Please. And introduce the baby.
Good afternoon, everybody. Good afternoon. My name is Giselle Hernandez, and this is Gael. We've been patients of Dr. Lin, well, Gael since he's been born, since last summer, and me since maybe 2 years ago that I recently moved to Chicago. And I went to one of the ERs in Bronzeville, and they recommended me to Providence. I didn't have any insurance in Chicago. I was like a lost dog here. And they recommended me to Providence, and I was pregnant, and then I was with Dr. Lin from the beginning. I was with Dr. Lin, and she's been like a hero. I'm a first-time mother, so I don't, first-time mothers, we don't know what we're doing, but sometimes, but she's been there for me a lot, and this facility looks amazing. I'm very excited to be moving over here and to see what's it gonna bring for all of us, because it looks amazing. Thank you to all the doctors. Thank you to all the doctors for all your hard work as well. Thank you to everybody. Without you guys, this wouldn't be possible. Thank you.
I want to thank everybody who joined us today, especially our patients, Kimberly Arnold and Giselle Hernandez Jimenez. I want to thank Diana Thorpe and Jan Sproul, who are sign language interpreters. Are there any questions? Any reporters with questions? Club Chicago, how much did it cost for the construction? Liz?
So it was $10 million for the construction overall.
And how many people will be staffed here?
Good. Introduce yourself.
Hi, Craig Williams, Chief Administrative Officer of Cook County Health. We staff about 75 staff overall at this location.
And how many patients do you expect to see in the first year?
I'll get that number for you.
Thank you.
One other question. Do you have to live in this community to be able to receive services here?
Absolutely not. We see patients from all across Cook County.
All right.
Any other questions?
One more, I'm sorry, I promise you. Are there plans to partner with other organizations, community organizations, to sort of, help get the word out about the clinic, or perhaps some programming?
Yes. Dr. Arnold Turner, Chief Hospital Executive, Providence Hospital. Yes, we plan to let the community know about this facility, especially with respect to mental health. That requires partnerships across the community with other organizations and clinics that provide mental health services. So we definitely will be seeking partners and getting the word out about this facility. It's not just for the existing patients, but we want to definitely expand our patient base. Thank you.
Yeah. 1, 2, 3.